Hello everyone, this is my quality assurance video for an exam that I did a few days ago. I did a lower extremity venous duplex exam on an outpatient that recently had a study done in December 28th of 2016. So this patient presented with bilateral edema and pain. So his physician was worried that he might have a blood clot again. So last time he had chronic DVT in his mid segment of the femoral vein, and then also chronic DVT in his popliteal vein on his right side. And then the left side was chronic DVT in the mid segment again of the femoral vein, the popliteal vein, the PT, and the perineal. Everything was all chronic last time. So as I was going through this study, the right leg was the same as the last study. There was chronic DVT in the mid segment of the femoral vein and also in the popliteal vein. As I went over to the left side, I found non-compressibility in the greater saphenous vein above the knee, which was a new finding, but the ectogenicities within the lumen of the vein were definitely bright, and the vein wasn't dilated, so it was definitely a chronic finding. And then he also did have chronic DVT in the mid-segment of the femoral vein. And as I got down to the popliteal vein, the echogenicities within the popliteal vein didn't seem very bright, and the popliteal vein seemed a little bit dilated. So I finished the exam and I went through the PT and perineal, which were both chronic still. And I went to my clinical instructor and asked her to take a look at this because I wasn't sure if this was a new finding, if it was indeterminate age, and her response to me was, I'll take a look at it. And as we went through it, she went through it at different angles, and the angles that she went in made the echogenicities a little bit brighter. And so I had the idea to look back at the old study, look at the old images, and see what the DVT looked like in the popliteal in the last study. And come to find out, it looked exactly the same as what we were looking at. So we knew that it wasn't an acute DVT or indeterminate age or anything like that. It wasn't a new finding. So that is what my quality assurance type of exam went for. We talked about it even after the patient left. The patient wasn't sent to the emergency room, even though I did find the DVT within the greater saphenous vein. It was chronic, so his physician that I called just told him to go home and to follow up with him in a few days. So I learned that definitely follow-ups for finding pathology are very important, and looking back at old studies are very important because they can help you determine whether DVT is chronic or acute or indeterminate age. It can help you determine that. I had help from my clinical instructor, and we went through this case. We talked about it afterwards, like I said, and this was kind of a coincidental QA type of meeting, but it was definitely one that I learned from, and I learned to always go back and look at the old studies if you have any questions, and always ask any text or your supervisor or anybody like that to help you out, and take a second look, because someone different might put their hand on the probe at a different angle, and it might turn out to be something different, or the echoes might show up different. So that is what I learned from my QA meeting, even though it was coincidental, and I hope you enjoyed this video.